Next speaker is Dr. Shyam Srivastava. He is the Director Radiation Oncology at SCG ICS Khubchandani Cancer Center, Mumbai. He completed his MBBS and post-graduation MD in radiotherapy from MGM Medical College, Indore in 1981. He obtained a degree Diplomate of National Board, DNB, New Delhi in 1984. He will be talking on cyber knife. So please welcome Dr. Shyam Srivastava.
Thank you very much, and I really appreciate. Thank you very much, Madam Chairperson. And first of all, I would like to thank the GP Association of Greater Mumbai, and especially Dr. Preeti Bhargava, Dr. Sunita Manglik, Dr. Neha, and the entire organizing team, and the GP Association. I'm also thankful to the SCG Cancer Centers who have given me this opportunity. And I'm really, very, very happy and to see that such a large number of people are still here, especially on Sundays. And my really regards to all my senior colleagues. I am saying there are some more than 90 years, my colleagues and my junior friends. I was supposed to give this lecture yesterday, but because one of my colleague at SCG Hospital expired, so I could not come yesterday, and I am just doing it today. I'm thankful that I've been told that I've been working in Tata Memorial Hospital for almost 35 years, and then retired from there, and then came to the hospital and joined SCG. We have been listening to the lectures earlier, and it was really very, very important to learn the various aspects. I was listening to Dr. Shah and Dr. Singh, how it is important that the various aspects we have to see. And similarly, I think we have to see the one aspect which is extremely important in our life, especially when I am talking of the general practice. I generally see that they should be the family physician because they look after all the physician. I mean, for me also the family physician look after about my health. There are certain problems which happens in our life, and it is very important if they are diagnosed at the right time, the right thing can be done. So maybe in next 30 minutes or so, I will elaborate on something which are the newer developments which everybody should know. I know when I was doing my MBBS at Indore, there was hardly anything was told to us in oncology. We were not knowing much of the cancer. So many times the infection disease was more common. So the first attention was always the infectious disease. Later on, when I joined radiation oncology in cancer, then I started learning. When I came to Tata Hospital, the entire area was very different, and my perception about oncology was very, very different. So this is what happens, that we do not know much about the oncology. So that what happens if a family physician, even in my family, somebody can diagnose that it's suspected cancer in an early stage, patient is cured, and that is always remarkable. But if something is taken little longer time, and I know it should not happen, but many times people always say कि I've been delayed, मुझे बहुत देर कर दी है कि फैमिली फिजिशियन ने पहले tuberculosis जैसा ट्रीट करते रहे, 6 महीने निकल गया, now it is an advanced disease. So it is very important for all of us, especially at the general practitioner's level, that we should always suspect something which may be happening so that we can diagnose. Today people will not really thank you for something which you have done best to those patients, but even a small thing has gone wrong, people will start cursing the people. So if something like this, if the gentleman comes with a disease, something with a presented in a gradual hearing loss, we always think there is something, so we send it to the ENT surgeon, then it takes longer time. And finally, after 6 months or so, when the patient gets a headache or something, we take the CT scan and we find this kind of disease. Now, you know, this disease is currently, we know it as a schwannoma, which is really on a brain stem, it is pushing on that. So all the nerves, cranial nerves will be affected here, and patient will get a symptoms. And then patients afterwards taking various kinds of medicine. Because it was not diagnosed in the early stage, it has gone to a larger state, and then it comes to us for the treatment. So this is very important, that what we should do at that period of time. And today I know many times it happens that why the surgeon has, or why the doctor has not suggested a CT scan, MRI or PET scan nowadays. But it is always in the best interest of the patient we start from the base. So, but these are kind of things that happen. So I will be focusing little more on the brain tumors, which is also very important for all of us. If they are diagnosed in early stage, they can be really very well cured. And the various types of brain tumors are there, which are glioma. These are much more fulminating disease. Non-glioma, like meningioma, these are, many of them are the benign disease, but they need some kind of treatment, especially with surgery or radiation therapy, various kind of radiation therapy. I'm a radiation oncologist, so I will just a little bit more elaborate on radiation oncology, and also some patients will require chemotherapy, immunotherapy, like these things. But today, these things which we are diagnosing in the early stage are almost curable. We can see practically all patients will be surviving for a good length of period of time. We always owe to these gentlemen and the lady, Rongan, who has discovered X-ray, Becquerel has shown the radioactivity, alpha, beta, gamma rays, Pierre Curie and Marie Curie and their son-in-law and the daughter, they have really contributed enormously for the radiation oncology or radiation treatment for cancer. How the radiation works? Basically, when you say these are two methods, because when radiation falls, we know that we have got the lot of cytoplasm here, so there's a lot of water inside, and the nucleus, we look at the DNA, and when radiation happens, it ionizes. So when you're looking at ionization, it's an indirect effect. A lot of water is there which goes into HO or H2O2, you know, this hydrogen peroxide is toxic substance, and therefore the cell is killed. Second is effect is on the chromosomes, or the DNA, you can say. They are broken, and once they are broken, they will not be able to divide. And that is what we want. The tumors are there which are dividing rapidly, or they are dividing more than the normal tissue, and we want to stop their dividing. So these are the two methods how the radiation works. And there are various machines have come up over the period of time. I mean, the time of Röntgen, when we are looking at these, very primitive machines are there, but today they are highly sophisticated, and I am going to elaborate more on of the highly sophisticated machine which is currently available nowadays, that is the linear accelerators here. So various kind of linear accelerators are there. And here you can see this earlier period we were knowing that there was a cobalt unit. But in linear accelerator, there's an X-ray which is generated, the electrons are generated, and they are hit aloud on a target, and that comes out on a patient. So the electrons are generated, they are hit on a target, and the photons or the X-ray or the gamma rays, whatever you can call it as, comes on the patients, and that starts hitting the tumors, and then we find that effect is there. Various kind of machines are there, not necessary to know that, but these are all the newer development of the equipment, and the major issue is that we are having a more and more precise radiation therapy, highly precise radiation. I mean, today, if you see, look at the earlier period of Canon, there will be large fireball which will be passed on the enemies, so that it will destruct more and more. But today they are highly sophisticated. If you want to go to the moon or somewhere, it has to be highly precise and accurate. Similarly, all these machines are very, very highly precise from the various companies, Electa, Varian, Accuray, or the proton therapy which has come up even in Mumbai here. I will be more focusing on CyberKnife, which is highly focused radiation can be given. Historically, some of you may be knowing the first machine which came for a highly focused radiation for the brain tumor was developed by a neurosurgeon called Carl Lexell. So he, in Sweden, he developed this machine where the cobalt sources, 201 cobalt sources were there, which were focused on a target. So what you need to do there, you have to put a frame on the patient, and with the frame, the patient goes into this, and there are various cobalt sources, 201 cobalt sources. You can plug them or you can make them on, that will focus on a tumor, and it was highly effective because he was a neurosurgeon. He wanted to navigate we have to target the tumor in the brain itself. So therefore he developed this machine like this called as Gamma Life. Very expensive machine. Today it may be around 15 to 20 crores of machine, and the cobalt sources are very expensive. His another colleague, who was there, also a neurosurgeon. He thought that why to have such a machine which is only limited to the brains. We can't have it something because there are a lot of things, technologically things have developed, which is so that a linear accelerator can be put on a robo. So this robo can move, and now you can see this is a linear accelerator, and nowadays the robots are there, and we have got a large amount of computers, which are very robust computers, which can highly precisely it can move. So rather than giving radiation from these kind of angles, now we can give radiation from the almost 360 degrees from the various angles, so that it will focus much larger and it will give less radiation to the surrounding brain tissue. This is how he developed this machine, and this is called as a cyber knife machine. So earlier gamma knife machine, cobalt source were used. You have to have a frame and only to the brain, and the cyber knife that can be used practically every part of the body, and therefore the various things have developed. Now let me tell you very briefly that earlier period of time we were having these machines, linear accelerator, and generally by looking at the radiobiology, because large amount of tissue were radiated, including some normal and tumor tissue, we used to give a fractionated. So it used to be every day small doses of radiation was given. But if you can focus very precisely, a large dose can be given to that area. This is what happens in the cyber knife machine. We are focusing, and we are just focusing on very small area so that we can give a large measure. So that another treatment modality has developed, what we call as hypofractionation. In earlier period of time, we used to give radiation for 6 weeks or 7 weeks for either prostate or brain tumors. But today this is possible that we can do it in 2 weeks, 3 weeks maximally, or sometimes people are trying even in 1 week, entire treatment can be over. Now this is very beneficial to the patient. Suppose somebody is coming to Mumbai from outside. To stay in Mumbai is very expensive. So rather than 6 to 7 weeks staying in Mumbai, if somebody can be sent back within 2 weeks or 3 weeks, that saves a lot of money and also the time for everyone. This is the machine currently, which is, we call it a cyber knife machine. It can give radiation for almost 1200 angles. So now you can see this machine is moving around. So this patient is treating brain, but it can treat liver, it can treat prostate, anywhere it is possible that it can be focusing on this. So that and every time within 30-40 seconds it takes the X-ray. So you are very sure what you are targeting exactly there the radiation is going on. So now you can see this machine will be targeting maybe another 5-10 seconds. I will show you some how the machine is moving, and patient is stable here and can give radiation to the various organs. So by this machine now we got the target for a various area, not only to intracranial, to the spine, to the lung, small tumor of the lung, soft tissues, then prostate, and it has been very successful. In the prostate cancer, we used to give radiation for 7 weeks, and many of your patients might have been there in earlier period of time, but today people are trying, even in 1 or 5 fraction can be treated with the prostate. Just for all of you to understand, because the patient will going to come to you and they will go back to you after the treatment. The process is going to be, we examine the patient, do investigation, we look in the multidisciplinary with radiation, surgical, medical oncologist, with the pathologist, radiologist. Then once the radiation is decided, we decide how the modality has to be done. We do the CT scan, PET or MRI in these cases as necessary, and then looking at the tumor where the tumor is there, and then treatment planning is done, which is done by the medical physicist. Dose is decided, then treatment goes on like this. So the entire process here may be taking around 4 to 5 days of the after examination, and the treatment depends on if you are giving it for 1 week or 10 days or maybe for 2 weeks time, that is there. So that, because patient will come to you and they will ask you beforehand how much time it will take, so that is important. And very quickly I will show you the major process. So we do, especially when I am talking of the brain tumors or any tumor in the brain, we make this kind of immobilization devices. So during treatment, when the treatment is going on for around 30 to 40 minutes, patient is not moving, then we do the CT scan, MRI, and on this we do the delineation where the target is there. In that case, we are looking at the prostate here, so that after delineation, the treatment planning is done with a very robust computer, which takes maybe around a day or so. We sit with the medical physicists and look at that whether the distribution is correct. because when the radiation is going, it will, if I give an example of prostate, the rectum is behind that, the urinary bladder is above. We have to look at the doses to these areas also within that the area. So there should be acceptable dose to the surrounding area and maximum dose to the tumor area. Then in these cases, when the patient comes on the machine, as I told you, there is an X-ray machine, and in 30-40 seconds, the X-rays are taken. This is match. If they are matching, it is perfect. Otherwise, if they are not matching, the computer makes the correction by itself. Now, just 2 or 3 examples I want to show you here, like some acoustic schwannoma, as I told you in the very beginning. It is just very abutting over the brain stem here. So it is very important that the doses to the brain stem should not be very high, because then we'll have the permanent damage to this area. And here you can see beautifully it is covering the entire area, and entire other part of the brain will be minimally radiation. This can be done within 3 days of treatment, and patient can go back home. It will take little time, for almost 6 months to 1 year time, where the tumor will start shrinking, but for that period of time. Pituitary adenomas are something which is really very remarkable. After surgery, many times the disease is left behind. So that can be treated. And now here you can see the brain stem is far away, but this area can be treated very well. Sometimes the normal structures are close by, so they can be treated in 5 fractions. So if you give it in Monday to Friday, entire treatment is over, and patient can go back home with the entire thing. Arteriovenous malformation are really a major problem. Sometimes even after surgery, the patient continue to have seizures and other things. So here again, generally, a single fraction is good enough. If there is a small nidus, so maybe in 1 fraction the treatment can be done, and these nidus are really resolved. So in the brain tumor, you can see that very well. But as I told you, the cyber knife is quite useful in the various other organs. But the most important thing with us that, because in the lung, the tumor will be moving, small area certainly. So we have to be very careful. Now with the other machines, this is the black area, which is the lung. So this is the tumor, we take little margin, and large amount of lung will be radiated. With cyber knife, we know it because of it tracks the tumor during treatment. So this you can see minimal amount of lung will be radiated, and that can be taken very well with the small amount of lung. And this is what I was saying, it was tracking. So this is the cyber knife. As the tumor is moving, cyber knife is moving. So these are all the beautiful things which has come up with the technology, and nowadays it can be done. As you know that we will have reached to the moon also. Here also various gadgets are there which are used to really track these tumors and can be very safely treated. The very important aspect many times is there, especially in children, and always when there is a disease here, metastasis, spinal cord is very close by. We want to save the spinal cord and treat the disease. So surgery is one aspect, and secondly, for residual disease, the radiation will be of great help. This is how it happens. The cyber knife tracks the entire area so that there's minimum radiation to the spinal cord and the maximum to the tumor area. The prostate cancer is one where basically, especially in US, this has started because there the incidence is very high, and unfortunately in our country also coming up. Rectum is close by, urinary bladder is a little bit very close by, so the one has to be really careful in giving. And nowadays we know the little bit of radiobiology for the prostate cancer. Rather than giving radiation to 7 and 8 weeks, now we can really have this radiation within 2 to 3 weeks time, and entire treatment can be done in a short period of time and have a good control rate with these cyber knife treatment or the stereotactic radiation therapy. Another area which is a functional area is also, which is not a tumor, but we know that trigeminal neuralgia, very debilitating disease, because patients will not be able to even sleep, and in this area this trigeminal nerve can be really targeted, and generally we can give only single radiation in this area, and many times we have seen the patients get immediate response the moment the radiation is given. They are controlled and they do very well. So the earlier tumor, now he is getting a kind of relief that the reduced doses are there, and he is getting less and less radiation. Within few minutes of this thing, we can see that it really works very well. So the cyber knife treatment, that was my major topic today, has really revolutionized the treatment with the radiation therapy. And it is generally, it lasts for around 35 to 40 minutes of treatment, no anesthesia required, patient can go home even immediately after the treatment. So around 1 to 1.5 hours, they will be in the hospital. Rest of the time they can really move and have their normal life. And nowadays, with the experience with the cyber knife and the radiation, a lot more indications are coming up, especially when you're looking at the brain and vascular malformations, functional disorders. I said about even the OCD has been tried,
Sir,
and Parkinson's.
5 more minutes.
Yeah, I'll take 1 or 2 minutes only. Thank you. And the spinal cord, neurological. Now the head and neck cancer, very small tumor which is remaining, can be treated. Lung, I showed you one example. Liver, the pancreas, stomach, kidney, prostate are the various areas where the tumor area is small, can be treated very well. And as I told you that any treatment, especially if I am talking of oncology, is a teamwork. For the music you want to listen, then everybody has to work in tandem, from the percussionist to everyone has to listen. Similarly, this is also a very, very important area where all of us to work. And I especially say the all oncologists, when neurosurgeon, I have just put it because of the brain tumors are the major area. The general physicians are extremely important when we are treating. We generally say family physician, because the patient will have the most confidence with all of you when they go back. So the most important thing is the early referral. If the patient is referred at the right time, the right thing can be done along with the other team members like neurologists, the physician, and the medical physicists, technologists, nursing staff. These play extremely important role in the total well-being of the patient when we are talking. So what we have learned over the period of time is basically the sophistication which we have learned. So high precise in the treatment and the finish, that has really resulted in a best treatment which is available for cancer. I focused mainly on the cyber knife, but similar things are there on surgery or the medical oncology side, where the total target is mainly the precision and how best within a short period of time can be given. So thank you very much. And again, I really appreciate the GP Association for giving me this opportunity. I'll be happy if there are some questions.
Thank you for the informative talk. I think we can allow one question. If anyone has any question.
With cyber knife, we generally say 4 centimeters is an ideal site for, especially when we are talking, whether it is in the liver or the prostate or the brain. Brain is more important because surrounding area we have to save much more safer in that. Immunotherapy is coming up, and we are generally combining chemotherapy and immunotherapy, and also with radiation and immunotherapy that is coming up. But I think the result will be there within 4 or 5 years' time. Thank you.
Thank you, sir. I invite Dr. Chandrakant Kenia to felicitate Dr. Shyam Srivastava.